Peripheral neuropathy is nerve damage most often caused by diabetes, hence it's also referred to as diabetic peripheral neuropathy. Diabetic neuropathy is caused by high blood sugar levels or hyperglycemia. Not all the reasons for diabetic neuropathy are understood, but it's understood that high blood sugar is the main cause, along with high blood fat or high triglycerides, and high blood pressure in those who are overweight. It's believed that damage to the blood vessels causes decreased blood flow to the nerves. When this happens, the nerves are damaged due to the decreased oxygen and nutrients. Blood vessels depend on normal nerve function, and nerves depend on adequate blood flow. Diabetic neuropathy affects all peripheral nerves, pain fibers, motor neurons, and autonomic nerves. Your entire body has nerves, therefore it can affect all organs and systems. The nerves travel from your brain through your spinal cord and they branch out to every part of you. The nerves control everything you do, unconsciously and consciously. Diabetes is the leading cause of neuropathy in developed countries. 60 to 70% of people with diabetes have some form of diabetic neuropathy. The highest rate of neuropathy are in diabetics who've had the disease for over 25 years, although it can affect you at any stage of the disease. Some people with neuropathy have no symptoms at all, while most have numbness, tingling, or pain in the feet. The feet are usually the first to show the signs of diabetic neuropathy because they're the longest nerves in the body, but it can also affect any other part of the body. Some of the main symptoms are numbness, tingling, or pain in the toes, feet, legs, hands, arms, and fingers. Diarrhea or constipation, weakness, problems with urination, wasting of the muscles in the feet and the hands, nausea, vomiting, or indigestion, erectile dysfunction in men, vaginal dryness in women, dizziness or fainting upon standing up. Autonomic neuropathy can affect your internal organs and slow digestion, slow bowel and bladder emptying, and this can cause infections. It can cause impotence. It can affect perspiration. There can be excess or very little. It can affect heart rate and breathing, blood pressure, both high and low. It can affect vision. There can be an insensitivity to pain, a loss of feeling or numbness. There can be sharp pain or cramps, ulcers, and all this could even lead, in severe cases, to amputation. You can help to prevent or slow diabetic neuropathy by keeping your blood sugar levels as close to the normal as possible. This will not only help the nerves, but also help the vascular function. To test for diabetic neuropathy, your doctor will do a variety of tests. They'll do a comprehensive exam of your feet, because feet are usually the first to be affected, to assess the skin, the muscles, the bone, circulation, and sensation. He'll use a monofilament line, something like a hairbrush bristle, to prick your feet to see if you can sense the pressure. If you can't sense the pressure, it's a good sign that you've lost the ability to feel a cut, bruise, splinter, or any other damage. This places you at risk of developing an ulcer, which, when untreated, can lead to an amputation. Treatment with glutathione, a free radical scavenger, is particularly effective in the prevention of diabetic neuropathy in streptozotocin-induced diabetic rats, but it's of limited value when the neuropathy is already present. To increase your glutathione, take reduced glutathione at up to 1000 mg per day. N-acetylcysteine, the glutathione precursor, at 500 mg 3 times per day. Ensure that you have your daily 200 micrograms of selenium, for example by eating 3 Brazil nuts, or take the herb milk thistle or eat asparagus. Also, N-acetylcysteine is broadly used for respiratory problems, and it can significantly attenuate the neuropathic pain through a unique mechanism of MPP inhibition. CDP-choline and its endogenous metabolites, cytidine and choline, promote the nerve regeneration, and they improve the functional recovery of injured rat sciatic nerves. Typical doses are 500 mg to 1000 mg per day. You can see my other video on choline sources for more information about choline. People suffering from diabetes often develop equally debilitating complications such as cardiovascular disease, retinopathy, nephropathy, and neuropathy, which are significant causes of increased morbidity and mortality among diabetic patients. Previous studies confirm that hyperglycemia has pro-oxidative and pro-inflammatory properties, which causes diabetes-related complications. The researchers hypothesized that supplementing the diabetic patients with fish oil emulsion, which is rich in omega-3 polyunsaturated fatty acids, might reduce the hyperglycemia-induced pathological changes due to the specific properties of the fish oil. Typical doses of omega-3 are 3 to 9 grams per day of an EPA-DHA fish oil blend. Vitamin B12 deficiency is highly prevalent, especially in patients with diabetic neuropathy. In a study, an inverse correlation was found between diabetic neuropathy and the blood level of B12. Higher doses of metformin and male sex were factors that related to lower levels of B12. It's important to realize that due to food fortification with folate, the B12 blood test can give a false reading and fail to detect a deficiency. You can take B12 injections or take B12 in the form of methylcobalamin 5,000 microgram sublingual dose per day. A deficiency of thiamine causes beriberi, which is characterized by painful peripheral neuropathy and cardiomyopathy. Basic research has suggested that a thiamine deficiency can also be involved in the etiology of diabetic neuropathy by preventing the glycation of the nerve fibers as well as apoptosis of the endothelial cells. Benfotiamine is the recommended form of thiamine for blood sugar problems, whereas the synthetic form sulbuthiamine is what's recommended for its effects on the mind. Typical doses of benfotiamine range from 300 to 600 milligrams per day. As it's water-soluble, the excess gets excreted, therefore it's difficult to take too much thiamine. A new study has found that consuming garlic could help to reduce the levels of blood sugar in people who are suffering from type 2 diabetes, as well as offering other benefits in the treatment of the metabolic condition. It can help to regulate blood glucose and potentially stop or lower the effects of some diabetes complications, as well as fighting infections, reducing bad cholesterol, and aiding blood flow. A vitamin D deficiency and vitamin D insufficiency are associated with increased risk for painful diabetic neuropathy. This is according to a study published in Diabetes, Metabolism, Research and Reviews. Previous studies have reported an association between a vitamin D deficiency and painless diabetic neuropathy also. Get a 25-hydroxy vitamin D blood test and then supplement accordingly. Vitamin C plays a synergistic role in reducing pain in patients with diabetic neuropathy. Take vitamin C as liposomal C for the best results. The next best would be a non-acidic pH buffered form, with the worst being cheap acidic ascorbic acid. Vitamin C's effect is enhanced when taken with flavonoids, and flavonoids inhibit various pathways that are involved in the progression of diabetic neuropathy, like the reduction of oxidative stress, a decrease in glycogenolysis, an increase in glucose utilization, a decrease in the formation of advanced glycation end products, and an inhibition of the alpha-glucosidase enzyme. This all indicates that flavonoids such as quercetin may be a good supplement to your recovery plan. Another substance whose benefits can be enhanced when taken with flavonoids like quercetin is zinc. Zinc supplementation alleviates diabetic peripheral neuropathy by inhibiting the oxidative stress and by upregulating the metallothionein in the peripheral nerves of the diabetic rats. Doses can be 30 to 50 milligrams per day, but be sure to choose a form with high bioavailability. The administration of chromium can reverse the manifestations of severe neuropathy, nerve conduction abnormalities, and hyperglycemia. Chromium is an essential metal and it plays a role in many metabolic processes and in maintaining homeostasis. Vanadium seems to decrease blood sugar in people with type 2 diabetes. There's many cheap chromium and vanadium supplements available. For the development of nerve repair solutions, Collagen is a good candidate, as it represents a major component of the extracellular matrix of the peripheral nervous system, and it supports cellular nerve function from development to adulthood. Doses can range from 5 to 30 grams per day. This can be derived from fish or animal sources. Sorbitol. Sorbitol is a sugar alcohol, and it was once widely accepted as a sugar alternative for diabetics. It's also produced in the body when glucose is metabolized. The dangers of sorbitol, however, have been in the medical literature for over 2 decades. Today, there's an increasing controversy over the merits of this popular sweetener. Sorbitol is osmotically active, drawing water into the cells, and this causes these cells to swell, which can eventually result in serious diabetic complications, such as vision problems, the retinopathy, nerve damage, the neuropathy, kidney problems, nephropathy, and blood vessel damage. Alpha-lipoic acid seems to delay or to reverse peripheral diabetic neuropathy through multiple antioxidant properties. Treatment with alpha-lipoic acid increases the reduced glutathione, which is an important endogenous antioxidant. In clinical trials, 600 mg of alpha-lipoic acid has been shown to improve the neuropathic deficits. Doses can be as high as 600 mg taken 3 times per day, with higher doses being required by most diabetic patients. There's also compelling animal studies showing that a combination of alpha-lipoic acid and acetyl L-carnitine have life extension possibilities. Acetyl L-carnitine improves pain, nerve regeneration, and vibratory perception in patients with chronic diabetic neuropathy. An analysis of 2 randomized placebo-controlled trials showed this. Typical doses are 1 gram taken 2 to 3 times per day. This can also help to improve brain function. Berberine is a natural anti-diabetic substance. It can help to shuttle extra blood sugar to the muscles instead of depositing it as belly fat. It has similar action to the prescription diabetes drug metformin, that's also known as glucophage, but it doesn't have glucophage's associated side effects. It's also being investigated for its life extension purposes. You can see my videos on the anabolic triad and my video on life extension for more information about this. Recent results indicate that berberine could remarkably improve the nerve conduction velocity. Using berberine to treat diabetic neuropathy in rats and in diabetic patients, it was demonstrated that the berberine could significantly improve the median nerve, the peroneal in-nerve conduction velocity also. Typical doses are 500 mg 3 times per day in the form of berberine hydrochloride. The benefits of magnesium treatment have also been demonstrated in patients who are suffering from neuropathic pain, such as in those with malignancy-related neurological symptoms, post-herpetic neuralgia, diabetic neuropathy, and chemotherapy-induced peripheral neuropathy. Sugar is known to deplete magnesium levels. In order to determine your dose, slowly increase the dose until side effects such as stomach discomfort and diarrhea are noticed. Then slowly reduce the dose until you determine your maximum tolerable daily amount of magnesium. Many benefits may be noticed after a few months of supplementation due to magnesium's role in over 300 enzyme systems in the body. Make sure to take magnesium in the form of magnesium bisglycinate. 2 separate recent studies on coenzyme Q10 were logged into medical journals, one in the US and one in Iran. The Iranian study was undertaken to determine the possibility of increasing male fertility among those who were infertile. The US study in Miami, Florida demonstrated a reduction in diabetic-induced neuropathy. Long-term, low-dose CoQ10 inhibited neuropathy-induced pain. From the study notes, the dorsal root ganglia, sciatic nerve, and spinal cord tissue from diabetic mice demonstrated increased lipid peroxidation that was reduced by the coenzyme Q10 treatment. CoQ10 administration was also noted to reduce the pro-inflammatory factors in the peripheral and the central nervous system. The study concluded that coenzyme Q10 administration may represent a lower risk, high reward strategy for preventing or treating diabetic neuropathy. Ubiquinol is the most absorbable form of coenzyme Q10, up to 6 times better absorption than ubiquinone. Doses can be up to 400 milligrams per day for some conditions. Vitamin K2 is directly involved in the health, growth and repair of nerve cells. Vitamin K2 in the form of MK7 is also helpful in energy production at the level of the mitochondria, the energy-creating batteries in your body. These are highly concentrated in nervous tissues. Vitamin K2 deficiency, as well as high blood sugar, directly and indirectly damages your mitochondrial batteries. A preliminary study has shown that vitamin K2 at a dose of 100 micrograms twice a day for 8 weeks was well tolerated and safe with a therapeutic activity for the symptoms of peripheral neuropathy. Uridine, a building block naturally found in human breast milk, but is now made synthetically as a supplement. The uridine has many uses, such as improving brain function, verbal fluency, mood disorders, and increasing the generation of new synapses, increasing your IQ. A controlled double-blind neurophysiological study with uridine versus a placebo in 40 diabetic patients with peripheral neuropathy had 20 subjects who were treated with uridine and 20 with a placebo. The evaluations were performed at baseline and after 60, 120 and 180 days of the therapy, with a follow-up control after 90 days from the completion of the therapy. No statistically significant modifications were observed in the placebo group. In the drug group, however, the neurophysiological parameters improved significantly from the 120th day post-therapy when compared with baseline, and they were maintained throughout the follow-up. The authors discussed the results which demonstrated the treatment with the uridine can bring about a neurophysiological improvement in peripheral nerves. Typical doses can range from 1 to 2 grams per day of uridine monophosphate. Its benefit on brain function is enhanced when it's combined with omega-3 and choline. A research team at the University of California, San Diego deserves a credit for finding that cannabis has an amazing ability to greatly reduce and in some cases completely eliminate diabetic neuropathy pain, and all without the need for dangerous and typically ineffective pharmaceutical drugs. Check the legality in your country. CBD tends to be legal in many more places than THC, and one study shows that CBD kept chronic inflammation and neuropathic pain at bay, which tends to affect the hands and the feet of people with diabetes. You can see my video on CBD and blood flow in the brain for more information on possible CBD uses and doses. Prevention is better than cure. Therefore, these sorts of complications can be avoided by changing your diet and lifestyle early, before these problems develop. The more time that your blood sugar goes uncontrolled, the more damage that it can do and the harder it can be to reverse. However, don't lose hope if you're only now just realizing that you have a condition like this. There's still numerous supplements that have been proven to help, and it's never too late to make changes to your diet and exercise routine to help your symptoms. Be sure to check out my other videos on type 1 and type 2 diabetes for more information on ways to help to improve your blood sugar levels. For more information about the herbs or supplements discussed in this presentation, check out my website.